hear me singing my sound check song.
Oh, really? What you do there? Broken brain.
Oh, no. Oh, I was just doing is the input too high? You know, that kind of thing.
Oh, I'm with you.
Yeah. Well, I will say, honestly, the little broken brain thing at the beginning is my voice. It just was like an app on my phone that I used to do like a metallic robo voice or whatever the setting was. And then, that's how history was made.
It certainly was.
There's Steve Jobs in his garage, and then there's that. Those are the two great stories of our generation, I think.
So how you doing? It's good to see you.
Oh man, it's good to see you too. I'm all right. I don't know, I'm doing okay. How are you doing?
I'm all right too.
Yeah.
I see you're in a new spot in your house. I noticed.
It's actually an office. I rent an office. I just moved my office down the road, to a different place. I'd been at the other place with a kind of group of therapists and things for a long time, mm-hmm. And it was like a group practice. And there's like I'd just been there, I guess, long enough to where it was mostly it was expensive because you had to buy into this group practice kind of thing. And I didn't use a lot of the perks. I just liked the people who started it and been there for a long time. So it was finally time to say, all right, I don't, need to be trying much. I really was honestly the major reason, because I really do like the people. But how about you? Are you still, I guess I assume you're still with the place because your email still worked.
Yeah, that's good. I'm still improving lives Improving Lives, or I hope so anyway. So I've moved house. I've got married. It's all changed.
All changed. Wedding had happened. Yeah. Congratulations. I was going to ask if that happened yet. So
there's the evidence. Thank you very much.
Oh, you can prove it. Well, that's great. How did you guys have to do adjusted size ceremony, or was it during the brief window when COVID was gone before it returned?
It was actually. So in end of June, I think we unlocked, like nothing had happened. We sort of abruptly came back to what we were doing pre-March 2020. That was in England. And then we've got this weird thing going on, which probably sounds a bit like your federal system, in that Wales, Scotland, Northern Ireland all do slightly different things in terms of a few things, but COVID seems to be one of them, and COVID restrictions. So we got married in Wales, which is slightly more restrictive. So there were some masks. People wore masks in the ceremony.
So it's slightly more restrictive. Okay.
Yes. Yeah, than England. England sort of went clean break. Yeah. We're getting back to normal. Wales said, okay, we're going to keep masks in shops. We're going to keep masks in public places for the meantime.
Yeah. Okay.
Can't remember if they're still doing that. But in August, when we got married, they still had masks. Because interestingly, a wedding, I don't know, if it's the same in the US, in the UK, a wedding is classed as a...
No.
Do you have those things, marriage?
We still do. Yeah.
So it's classed as a public event. So anyone can come and object to your wedding if they so choose.
Oh, wow.
I know.
Okay. Huh.
Hence the mask. So as soon as the ceremony was over, which took about half an hour, we stripped the masks off and we had a dance and a few photographs and a bit to eat. And it was like being... Yeah, like it normal.
That's wild. I didn't realize that. So no matter where you hold it or anything, I guess the after reception is you can have it. You have a private area, obviously.
Exactly.
But it did. So it doesn't matter where you hold it. Like wherever you hold a wedding, it's still considered a public event.
Yeah, if it's if it's a religious ceremony with I don't know, whatever creed you follow, or if it's a civil ceremony that we had, you contact your local council and they provide you a registrar to deliver the ceremony.
Yeah,
that has to be. I suppose you're, in theory, of course, we were right in the middle of Wales somewhere, and no one's ever going to find unless they really wanted to object. I think we've got away with it.
Is that why you decided to pick?
fleeing all my ex-partners. Not at all. No.
Now, are you guys from there, or one of you, or some of your family, or just is it pretty? I don't really know Wales that well.
It's very pretty, but I've been. My family have been going there for 2 generations now, so it's quite a special place to us. We don't have any family there.
Cool.
We just ended up going there every summer for 50 years or something in my family. So I thought it'd be a nice place to tie the knot.
Yeah, that's great. Well, that's really cool. That's great. Well, congratulations though to you. I seriously though, I was hoping that had taken place. I didn't know if the pandemic had disrupted your plans and things. I mean, I know it does with other things, or did with other things, but so yeah, I'm happy you were able to have an actual wedding.
Yeah, I feel very lucky. We didn't have to change the date like many people did, and we'd always set it for August. So we're very, very fortunate.
Yeah,
very fortunate. Really.
I have a friend who she and her fiance sent out an email to a bunch of people. She's a therapist that rents an office where I used to rent, and she sent it to this whole big group email that I'm part of, whatever. And she and her fiance had said, "Hey, we're getting married. We just can't wait." And this was at the height of quarantine and everything, right? And it said, we just can't wait. We're just going to do it, small ceremony in our home. And what we'd like to do is have everyone drive by and honk outside. Now, they did that as a joke. They weren't really doing it. But so many people started to do, actually, by the time they got the email out and thinking, oh, this is funny, a lot of people were actually doing stuff like that, right? For reals, right? All the ingenuity people were having during the pandemic of saying, hey, it's so-and-so's 30th or 40th or whatever. Come honk your horn outside and, throw a rock through the window with a gift or whatever, or people were putting up, different little signs or hanging little pictures in the yard so they could take their kids around on a visual scavenger hunt. People were coming up with clever ideas. And so by the time they sent it out, everyone believed it. They were just like, oh, cool. Good for you guys. And they had to be like, oh no, we're just kidding. So
it's nice seeing all the ingenious ideas, that have kept us together to some extent during the last 18 months or so.
Yeah.
So what's it been like for you coming out of lockdown and sort of post, or not post, maybe sort of middle ground between pre-pandemic world and pandemic world? What's going on there?
I think your question sums it up a little bit too, right? The way, because where are we, right? I mean, it really feels like that quite a bit. I think especially if you live in an area where I live, there in some ways, it was like a significant cutbacks in activity by choice more than other places. Like you go to California, you go to some other major metropolitan areas or places that like Washington State or whatever, where they actually legally mandated a lot of lockdowns. They did that a little bit in Utah where I live, but really there was quite a bit of movement if people didn't want to. I mean, restaurants were shut down for a while. And so some of those things did. As soon as it became like, oh, vaccines, a lot of people were very eager to shed the masks.
Yeah, it almost feels like this winter period coming up, certainly for the colder climes where we are. I think it feels like this could be the start of something, or a return to something with this the new enemy in the new Delta variant. It feels all a bit down after I feel like we've had this lovely surge of enthusiasm over the summer we had. And I don't know about you, but well, I do, because I watch the news sometimes. We had a really successful vaccination program. People were, being vaccinated myself, and I've taken people we work with to have their vaccinations. And there's just a real party spirit in the places I went to. People were really keen to see one another, and they obviously were coming out of a lockdown ourselves at that point, and people. That was some form of like social contact at the vaccine centres. We know of one, there was a disco ball going, they put some music on, and it was great.
I had thought that it was pretty successful over there, right? I mean, do you have a handle on how many people, like exact number? No, I'm just kidding. But is it most people? or
I think these stats are a week out of date. I think it was 80% double vaccinated and 85% one vaccination. I think that's over 16s. And then they've just announced that 12 to 15-year-olds are going to have their first vaccinations at schools. That was in the past couple of weeks. So, yeah, I feel like we had like the wave of optimism, the summer when people went away, even if it was just in the UK, and which was great. And now it feels like feels like something's coming over the horizon.
I mean, yeah, it's this terrible feeling. And I think that's where you see the people that I've known, in particular, the people I've known who are vaccinated and have then caught something. And I feel like in certain areas, that's got to be more common in areas where you have lower amounts of vaccinated people. Obviously, they say if you've got all your vaccinations you are very, very unlikely to actually catch COVID after that, and if you do, it's not likely to be serious. But I feel like around here, where we have, I don't know. I mean, I think it's still about half, in my area, who are choosing not to. And then you see a higher incident of people who are vaccinated or their kids get it, who can't be vaccinated. So you're seeing COVID come into households of people who are being quite cautious. And that's frustrating. I also see there is a dynamic that I've seen that is weird because I think a lot of people didn't expect it. I didn't expect it, but we're getting colds again. As we're getting into cold season, a lot of people got colds when they relaxed the mask thing, which kind of makes sense, but I didn't think about it.
And yeah, absolutely. And flu coming back, and I feel like I've had a sniffle, and more than I've had definitely over the past. And it makes sense, right? I've been washing my hands really well. Not that just for all the listeners out there, I wash my hands really well anyway. But with even
but not
more
before the pandemic. You never had before, famously.
No. I suppose more regularly with hand sanitizer.
Obviously, but no, it changes, right? It changes the focus. Yeah. And seeing that it reminds me in a way of when the first time when you have a child and they get sick as a baby, you're so consumed with taking care of them that you don't stop and think about, I can catch a cold from an infant. Like, I mean, it sounds maybe even silly to say, but I think I've known a lot of parents who've had this experience. It's like, I'm starting to get the sniffles. What? Oh yeah, that's right. I've been taking care of a sick baby for 3 days. Oh yeah, that's transferable. Same thing is like I'm not walking around with a mask everywhere. I'm gonna be more likely, and also we're going more places, so the cold and flu comes back. And then now there's flu shots. Got to worry about that. Gee, when does it stop? No, I'm just kidding. But it's the same. but being able to bring back the same health precautions that we kind of thought about, and I find it's almost hard to remember how did I navigate that before the pandemic. I don't remember worrying about it as much, but I do remember thinking about it.
Yeah, I think hopefully something we take forward will be to be mindful of our own ability to infect others when we're unwell. I think I've enjoyed not having a cold, and I know that I will get colds again. But there's more serious things than colds out there. And I don't mean to I always seem to bring the mood down, Dwight, and I'm sorry.
That's why we are
we are faced with a bit of a antibiotic apocalypse at some stage, with their reduced effectiveness. And maybe part of a simple way we can combat infection is to not catch as many things, I suppose. But I don't know.
Yeah. Well, we do end up getting to preventative measures when we don't pay attention to all the things that you hear people talk about. It seems like a generation later start to happen. I mean, that's what we're seeing, right? I remember being a kid and saying, don't overuse antibiotics. And everyone's like, yeah, as long as I get one. And it's like, watch out for the way that we're handling germs. We're going to breed super germs and whatever. And everybody hold off on your tweets and things. I'm not saying... I'm not a scientist. I'm not saying like that's why COVID. I'm just saying it is interesting growing up hearing all these things of like global warming and disease and now we're kind of like, is it too now what are we going to do? Some of those things are actually happening and it's very scary. So that's darkens things up a little bit too. I'm trying to help bring us down.
But tell me, Dwight. Let's look more positively. What about, as I suppose the US and Utah starts to open up again? Are you, or has been open for a little while now? Are you seeing kind of the people you support, people you work with? Have you seen their kind of a recovery in their mental health? What's it been like for you seeing that?
Yeah, I mean, that's something that I think is necessary and important. And because I don't know that we ever, some of us did, and some people talked about it, but I still don't hear a lot of discussion about the specific psychological issues that come up from all the closure and all those things. It seems like the only time I really ever hear that argument is when people would say, we shouldn't wear masks, psychological stuff, because, or people saying we should for the same reason. And they just want to trot it out to make an argument instead of saying like, well, let's look at the real recovery and healing that we have to do. One of the things that I'm seeing that people are going through is trying to feel a feeling of confidence. And one of the great things, I'm trying to remember if we haven't chatted for a while, so I don't think we touched on this dynamic. There was a funny dynamic of people who were very, very pro CDC recommendations, pro-masking, pro-social distancing, obviously excited about the vaccines. When the CDC started to say, okay, here's the conditions under which you probably don't need to wear a mask. It was funny because there was this big flip where people who didn't like masks were kind of like, oh, cool. They said we don't have to. The ones that you keep saying are in charge. And ha ha ha. And then the other people who were way into the CDC like 2 weeks before were like, well, hold on, CDC. Wait a minute, science, and there was this flip. And I think that's where the psychological and emotional stress started to show itself to say, in a crisis, we look for something we can do, and a mask is something we can do, right? And so to take that off when it's appropriate and say, well, gee, I mean, for me, I see like someone comes into a therapy session, right? And let's say we're both vaccinated. We're sitting in chairs across the room from each other. And it's like, we can take off the mask. We really can, right? And for some people, it's like, I wasn't wearing it anyway or whatever. It is, even during social distancing, once people start to come back, it's a little hard to talk with the mask on anyway. But for some people, there's a nervousness around that of being like, oh, gee, I'm breaking some rule. And so adjusting to having a different set of rules that involves me being confident that the world is safer, it's been tricky, but it's also been really freeing for people when they can embrace that and say, I'm probably a lot safer than I used to be. And I don't know. Are you seeing people kind of engaging with the world more?
I think it is not a kind of set answer for everybody. So we've, as pre-pandemic, we used to run kind of peer support groups for the people we work with. They were really missed in lockdown, and we tried to do this Zoom alternative, which worked probably as well as it could have done, but it's never going to replace, as we know, that kind of face-to-face contact and interaction.
And for some people, some people it works great, and some people it doesn't work at all, really. Yeah, some people
exactly. Some people just point blank just said they can't do that. We offered them equipment; it's just not for them, and I get that. So we found that people have been actually returning to our groups in droves. They're really well attended. People have remembered those friendships they've built. They've been able to rekindle those and it's really inspiring to see actually the way that people we work with can often find it difficult to form really good friendships, relationships, and that they've sustained throughout 18 months. It's almost like we've never been away, which is great. Yeah. But that isn't to say that's everybody. And there are definitely some people, and it's people who had pre-existing mental health, I think, who've been most impacted by the pandemic. It's them who I think research has shown. I think it was Mental Health Foundation in the UK showed that it's them who had the worst effects of the pandemic, because already suffering, they're already struggling, and to have that as an addition on top. So yeah, I don't have a black and white answer for you, I'm afraid, Dwight, but that's my experience.
Well, it's complicated. I mean, it really is quite complicated. And I think that it is also I was going to say misunderstood, but the better way to say that is not understood. We just don't know yet all of the effects that we've had with that. Take little kids, for example. A lot of them missed out on like kindergarten, and so they go right into first grade. And when's the last time, I would think, in majority of kids, that's a pretty new thing to have that many kids who didn't have the pre elementary school experience as much. And so they get into their first grade, and then how does that affect academic skills? Some kids who were born right before the pandemic, they're basically on the bridge of having their visual memories all include times where they only saw their parents, right? Things like that.
Mm.
And it's amazing how some of them seem to roll right with it. And just they meet kids and they meet other adults and they're like, okay, cool. And then some really, really get quite nervous about it, right? So it's interesting to see how different people do react. One of the things that makes trauma and grief worse to deal with is complexity. Complexity makes it, I shouldn't say better or worse, but it makes it more complicated, because that's what complex means, I guess, as I'm saying that same word, really. But it gets more tricky for people, and it certainly amplifies the experience. I also see where people, in some ways, as you've said, the way that they've dealt with it and tried to make contact throughout, we do find some things out. Take the Zoom, the other side of the Zoom sword, if you will, is that there are people who have realized like, oh, hey, you know what? Here's the thing that works for me. And I can actually do certain kinds of appointments. We can do those online. And I even have some clients who, not for COVID reasons, have maintained Zoom contact because maybe they work a lot of people in my area travel to Salt Lake City, Utah, which is about 20 to 30 minutes away. More than that if it's during rush hour, more than that if it's the southern part of it. I'll go ahead and lay out the highway system here for everyone just so they understand it. No, but it's essentially difficult for them then to say, are we all competing for the same after, the same at later afternoon slots, and what, how often will my boss let me cut out a little early so I can try to make it on time if I can beat the traffic and if Dwight has more than 5 of those open a week, right? And so what that turns into, though, is that I can take a lunch hour. And if I take a lunch hour, I can go in my car or my office if I have a private area and get on my phone and have my therapy session. And it's not unusual anymore, right? Or even if I'm sick, I could still maybe, for me, I could still oftentimes do some appointments, even if I'm ill and don't want to infect someone else if it's not a major thing or whatever. So there's some options that come up that people find helpful. And some of those are hanging on, I think. Some of the same adaptability and cleverness. I wondered if you guys, related to that, are you guys running into the job thing where you can't find enough people to work jobs? Is that more of our deal?
I was just in a meeting today, actually, and that's always the preamble to an interesting conversation. I was in a meeting today.
Absolutely. So I got excited as soon as you said it.
And in health and social care in the UK, we do have problems in finding people to fill posts. Actually, it's a challenge, and it's leading to inpatient units in mental health hospitals, real delays, short staffing, delays in discharge. It's having a real impact, and it's an ongoing problem, really. I think from a very selfish and level in terms of our organization, we haven't experienced that yet. We've done a few recruitment rounds over the pandemic, and we found some fantastic people. And I don't just say that because they might be listening. We have a wonderful team, and that's why I love doing what I do, to be honest. So,
well, that's the impression I've gotten of Improving Lives, is you guys are quite tight, right? Quite close as far as that goes.
I mean, it's a bit, I'm going to be a bit soppy here, but I like to think of us as a bit of a family, both in terms of the team, the staff team, and the volunteers who we've started out with 4 at the beginning of the pandemic, who've been with us for a long time. And now we're coming up to 20, and they all feel like a big part of the family. It's really nice. And then the people we work with who, come to our groups, they were on TV recently, and someone very kindly spoke up about the support they'd received, very eloquently put. And yeah, so in terms of coming back to staff shortages, we're really seeing it. We're not just in the health and social care sector. I think hospitality,
Yes.
it's incredibly challenging because I think people have probably had 18 months of do you call it furlough? What's the deal over in the US? The when you get paid when you're not able to do your job.
Yeah, I mean, furlough isn't used as often because it doesn't exist as often, I think. It is the term that means the same thing. I think a lot of people's experience here is getting fired or getting laid off without pay. In a lot of cases, particularly in hospitality in that sector, it was just kind of like, hey, we don't need you, so it's scaled back, right?
But when in life do we get the opportunity? You get this furlough period. You might be on furlough for 12 months even, or you might be dipping in and out, if you're lucky, but you get that time to consider, what do I want to do? What's going to be productive for me in the long run? And I suspect, this is maybe it's a harebrained theory, I don't know, but maybe you think about your long-term prospects, and hospitality has suffered such a great deal, understandably, and maybe people are making that decision. I feel like I need to earn money to live, and hospitality is just not the place I can do that anymore. And I don't know how
the bottom's going to drop out of it, right? Exactly, at the moment's notice, because I think that you tend to think about that as far as like hospitality services, particularly working in food service. Everybody that I've known who does that kind of career-wise, or at least does it for a significant amount of their adult lives, they look at it as, well, there's a lot of negatives to that field, but I know I'll always have a job. And then it's like, oh, nope. And also when we talk about the whole, like, look for the future and how are we going to deal with disease in the future and all that and all this, you also bring that. Speaking of harebrained schemes or harebrained ideas, let me throw this in there too. Automation of the food industry there are restaurants in the parts of the world, and even some around here, although it's not as common in the US, where you can have like one employee run the whole thing, right? One or two people run the whole restaurant because everything's automated. Some of it's like, oh, I'm going to select that meal, it's made. I mean, they have machines that can make a burger just as well as a human can, and that's always been there. But what do you do with the workforce? Well, you bring some of these things together, and it's like, okay, well, if disease is going to force us to have less people interacting with each other in the future, and we already have this technology, I mean, how long is that going to be? There's already some things that have gone touchless, and some restaurants close their lobbies for a long amount of time and just don't need the lobby anymore, right? So, yeah, and the other part of it too is I think even if it's been bad for someone, and I'm really open to hear what people think about this. If anybody wants to tweet at me about this and tell me your experience. But some people I know, even if it was bad and they weren't getting paid, they're still around. They survive somehow. It's like if I go through a year of my major employment dropping me, I survived. I either got other work, pooled my resources with friends or family, cut down expenses, some combination of all of those, did some, like, whatever it is that people did to survive. They're probably still capable of doing that. And when you look at it and say, boy, if I wasn't in love with my career before and it was low paying and I'm surviving, why wouldn't I do that? And I think people miss the mark because they'll say like, oh, government handouts and unemployment's too good and people just don't want to work because they're lazy. And I think, that may exist, but I think more often it's people who've been like, hey, I'm getting, I've survived this far. Do I want to go back to something that I was working maybe more hours and still just barely surviving? And so there's a demand for wages and things like that people are having to pay more to get workers. And it's a very interesting time, challenging though, but an interesting time to see how these industries are being affected.
I think so. And I don't like the comparison myself. I feel if very paltry dole money or unemployment benefit is
right,
is being compared is kind of a great deal. I think maybe the wages might be the problem more
Right.
than the unemployment benefit. Call me Karl Marx, but that's my view.
No, I'm one of those too. I'm very much like, oh, well, the younger generation doesn't want to work, and it's like I'm okay with that sentence as long as you then add for the amount that you're willing to pay them. I mean, you have to tag that on, right? Because
or if you put, in parentheses, meaningful work, perhaps. I don't know.
Right. And I feel like sometimes there's a lot of buzzwords people use that they'll say, like lazy, for example. Oh, the workforce is lazy. Okay, so that means we don't have to do anything about it except criticize them. Okay, great. Now, the other thing too that always bugs me is a lot of times it's the same voices that say they're too lazy to go to work. They should just go to work. They're the same people that say if you don't like your wages, quit and get another job or force your employer to pay you more. And it's like, oh, okay. Which one are we to do here? Just shut up and take what you're offered, or actually, demand more. So that I'm very much with you on that one, as far as that goes.
I think we're doing that thing again, Dwight, where we just agree on everything. We don't have any counterpoint or back and forth. I'm sorry.
That's why I was going to bring up the Revolutionary War. I thought maybe that would.
I mean, you can try. I'm sure I'd side with you guys. Colonial powers.
I was trying to get you to stand for King George. You were playing that Hamilton song when I called in, but anyway, it's something. It is interesting to me how it has, and I look at it and say like that increases some ingenuity. But I know that there's obviously, just like with whenever there's a system that's damaged or crashes, I think the period of transition is the hardest part. And I mean, you look at that, just like you say in the health industry, boy, well, maybe they need to look at how they're doing things. In the hospitality industry, maybe they need to examine how they're doing things. It's kind of hard during the transition time, though, right? Of like, that has a real human cost.
Of course, yeah. Talking of transitions, I suppose, I'm aware that the vaccine is free in the US. Am I correct with that?
Yes. Yeah.
So, I mean, are US citizens entitled to ask, well, why can I get this free and I can't get all my other shots free and I have to be insured for those? I mean, what do you think that's going to start a debate really about healthcare and what people are entitled to?
I think it does. I think it can. I mean, people do talk about it. I always wonder, when will we get to a point where it's actual insistence? I mean, it's one thing for a bunch of people to say, I don't want to work for Starbucks, and then Starbucks has to raise its wages. I kind of look for what is the medical equivalent of that, right? Because it's like different power differential. I mean, and once again, I'm not picking on Starbucks. So I don't know anything about what Starbucks pays. So I'll say any business, right? They control the access to work, but they also have to have people working to stay in business for themselves. There's a little give and take there, relationship with the workers. If I go to a medical need, they got all the stuff, right? They got all the medicine. It's not like I'm going to go, I'm not going to get your medicine. I'll show you. So yeah, that's you guys have that debate still, even though you're in a different boat than we are medically. Don't you have people who advocate and say they want to go to a for-profit system, or they want to mess up the good system that you have?
I think there are some politicians in government who've spoken out for an insurance-based model, and I think and the defenders of National Health Service as we have it always, I'm afraid, point to the US as an example of how they don't want it to work. And that would be,
yeah.
And then I'm sure people in the US point back and say,
we're number one.
Well, there are problems with the NHS, goodness me. I think mental health provision could be massively improved. I know that I read recently that I think cancer treatment has some of the worst outcomes in Western world in the UK, and that it needs to improve on that. But I think what the consensus in the UK anyway is that free healthcare at the point of use, to have it publicly funded by everybody, it's a given. It's almost like a I've heard some describe it as a religion. You kind of,
Mm.
we don't have particularly religious society. We don't have, well, we have a royal family, I suppose, but aren't kind of in power at all. You know,
Yeah.
we kind of have this NHS. It's this national institution that people just, I don't know, accept and value. And, you know, I think it has its problems, and I think some politicians would rather it was elsewhere, because obviously it's a hugely profitable pie to slice up and give to certain pharmaceutical, medical organizations. But there's, so I think that may happen more and more, unfortunately. But I think if it was ever there would be a cost to go and see your local doctor, there would be uproar.
Yeah. No, that's the thing that I always hear people compare and say, "Oh, you know, here's the negatives. You have to be." Is your biggest negative in your system that I'm aware of? Of course, I'm over here hearing people, you know, say whatever they say. Is wait times? Isn't that it? Like wait times to get procedures and such? Is that actually a problem, or is that just an American thing that we like to say?
I think there are. I mean, and there've never been as long waits as there are now, because obviously nothing happened during COVID. Everything was cancelled apart from the most urgent procedures. So they've never been as long, and there's extra funding to try and reduce those wait times. But yeah, commonly what would happen is when there's a period of kind of winter pressures, or there's just not enough funding because funding has decreased kind of in terms of real term funding, like it's been lower than inflation and not enough of what they need. What happens is that, the non-urgent, the hip replacements, the knee replacements, what they can class as non-urgent, just they go by the by, and they get added to the back of the list, which it is most definitely a problem.
It's a problem that people will say that we don't. Oh well, at least we don't have that problem, and it's like, well, but we're getting there. We're trying really hard to have that problem. Our problem is more like somebody that doesn't get a procedure because they can't afford it, and so they just can't get it, and so then they work with the pain they have, or they die. I mean, you know, that's like, you know, and that's not good. That's not ideal in a medical system to have someone die because they can't afford their medication, for example. And if insurance won't pay for it, you have some medications that are hundreds of dollars a month, and that's just not doable. And as a matter of fact, even if it's doable, a lot of people still aren't going to swing $600 a month unless it's life threatening, right? Even if they can afford it, right? I mean, you think about it, and it's like, well, what's the ratio here? Is it going to kill me sooner? Am I going to, you know, just have a little more discomfort versus like the discomfort of having to budget that, even if I can afford it? So, it's not great. I think one of the things that's difficult though is if you ever change something like that, and this is not a policy podcast, so I'm ignorant of a lot of those things, I'm sure. However, I do know that one of the things the pandemic illuminated for a lot of culture, and here in the U.S., is that our system works well in some ways, our whole system of life, as long as it never stops. If there's money moving from this pile to this pile to this person to that company to this, you know, consumerism and capitalism, and when you stop it for 12 months, essentially shutting down whole industries, then it goes really crazy down the line, because then, so I don't know how you change. You obviously can't change right away, because it's like, well, you've got all the payment that goes to the doctors that they then are paying to their medical school bills, that, or, you know, different insurances. And then you've got the insurance industry that is in there making a lot of decisions and determinations. And what do you do? Just take them out? I mean, you know, how do you change that without lots and lots of bigger gaps in people's access to healthcare for some amount of time? So that it's very, very tricky, even though those of us that are advocates of a more national system, if it's like, wait, what do you think we should do? How do we do that?
What it feels like is it's longer than a term of office to produce that piece of work. Exactly. And it feels like it needs everyone to work, to come to a collective agreement that we're going to change healthcare in the US, and Republicans, Democrats, we're going to work together because we all agree that it's more important than a 4-year term and us getting re-elected. But it feels like and not just in the US, in lots of countries, and I would include the UK in this, that it's so polarized that it almost feels like there'll never be that consensus that it's a long-term project. It's a huge, generation-defining piece of work that needs consensus and people working together. And it's there's a similar thing going on at the moment with social care in the UK. So we have a publicly funded health service, but as soon as you get home, healthcare is classed as social care. So although 80% of healthcare is delivered at home in the UK, it's funded by different things. So you don't have a national social care service. So that's some of your locality will pay for it, but you contribute according to your means, and it's not funded by taxation like the NHS is. So you've got this weird sort of split in how things are paid for. And it just needs to be sorted out. Come on, the government needs to kind of say, right, well, we're just going to have one system. We're going to use taxation. We're going to use this, and this tax, and it's going to pay for everything. But it's been rumbling on for years and years, and no one has ever sorted it, because one party will say, oh, that's never going to work, and they'll campaign against it. And then they'll say, oh, that idea is never going to work. I'll campaign against that. So frustrating for the people who are accessing the services. Like, come on, just get it together.
And when it's seen, yes, and when it is viewed that way as a contest, right? It's like you say, and I want to have a win while I'm in, kind of a thing. And also it represents a party and a group of people, and philosophical. The philosophical is the word that I said, but I meant philosophy. I think philosophical is something you get off a food truck. But one of the things that you said, 80% at home care. That's interesting. Is that just kind of...
Yeah, again, another gem of wisdom from my meeting, which is clearly more interesting than I made out. Yeah, so, I mean, we're trying to keep people... I mean, hospitals are only it's finite buildings. We can only fit as many people in them as we can. People go home, they get support at home. And yeah, I couldn't believe that myself. But then when I thought about it, I thought there are people who get their medication every day. Someone comes in, gives that to them, gives them a cup of water, and that's their... and they may go to hospital every now and again, but most of the time their healthcare is going to be delivered at home.
Yeah, I guess that makes sense, actually, when you think about it. But that is interesting, because it's not what we think of when we say healthcare.
No, perhaps not. And I think we probably think of blood tests and someone taking a sample and lying in a hospital bed with, lined up with an IV line or something. Mm-hmm. But I think, coming back to the pandemic, as no doubt we'll do for a long time, it's the people on the front line who aren't in, as well as the people in hospitals. There's a program in the UK at the moment called Help, and it takes us right back to the dark days of March 2020, and it's set in a care home. It's about a young woman who just joins as a member of staff just before the pandemic, and she's basically on her own in this place with lots of people with this disease. They don't know what it is, or they don't know how to deal with it, and the ambulance can't come, and all these people are just suffocating. It's just really hard-hitting program, which, you may want to have a box of tissues, to be honest. So so it's those people delivering the healthcare who are even more so than the nurses and doctors in the hospitals and GP surgeries. They're the ones who are just working the hardest they possibly can and are getting paid the least. I think they're possibly the biggest heroes of the pandemic, those people.
It's the call the midwife of pandemic, basically, kind of thing, where there's very much coming into the home environment. I'm one of those. I think that there's a lot of lip service paid to people's heroism working in the medical field. However, as you put it, the most at risk are oftentimes the ones that are the lowest paid or underappreciated, as in we don't even know they exist, like you just said. that show highlights the existence of this wrinkle of medical care that we don't think about really much. So no, that's very interesting. What's it called again?
It's called Help.
Okay.
I'm not sure it's available. I think so. It's on what we call Channel 4, and I think it's only available in the UK. So maybe you can find it on a dark corner of the internet.
See, everyone's got a VPN. No.
That's very true.
Do you still have, do you still have to have a license for a TV in England? Is that a thing?
Still have to have a license? Yeah.
Okay. I
Yeah.
I just heard that when I was a kid, and
But I think if you're, certainly it used to be the case, over 75s would get it for free. I think they might have recently gone back on that. And yeah, it's about, tell you how much it is, about £145 a year.
okay.
And you get the BBC, so that's like 4 channels, loads and loads of radio stations, and I suppose you can also get free tickets to BBC kind of live shows, like I suppose you call it Dancing with the Stars. Yeah. So you sign up. So as part of the deal, you can go and see Dancing with the Stars, as you call it, Strictly Come Dancing. You can go and see any radio shows you want to see. Obviously, it's a ballot, so you get in or you don't get in. But it's almost like a sort of taxation for the TV tax, I would call it. And you get a news channel, which is, the idea being it's a neutral broadcaster. And, you don't get your dichotomies of CNN and Fox sort of battling it out. This organisation in the middle. That's the idea.
Yeah.
And then, that's what you pay your £145 for. And people argue for all day long about whether it's worth it. Another thing to argue about. That's what it is. Right.
Do you have to produce it? Does they have people checking? You ever had that?
Yes. So
they kick your door in and say, "Where's your TV license?"
Yeah, it used to be a criminal offence to not pay your TV license. You're taken to court, and you could, I think, if you kept refusing to pay it, you could eventually go to prison. Long way down the line.
That was, I remember that's how I actually found out it existed. Was my mom watching public broadcasting over here, where they just steal a lot of British shows, because I think they don't have to pay for them. I don't know if that's why actually, but PBS obviously shows a lot of British shows. And seeing that on some show, the reference to someone getting in trouble for it, and I was like, "What?"
Well, now I think it's not a criminal case anymore. They've made it a civil case. I think you can be pursued, but you can't be put in prison anymore. But someone could come knock at my door and say, "Can I see your TV license?" Technically, if they suspected I didn't have one. And they can sit with a little van outside and, detect if your TV's on.
Yeah, if you're watching it, that was the little device, right? Yeah. See, this is fascinating to me. I don't know if anyone else cares, but this is like, I imagine having that job of sitting in a van and saying, like, they're watching TV. They're watching TV. Yeah.
So is this your, and it's not, by the way, if you somehow magically removed the BBC channels from the TV and just watched all the others, that doesn't sort of doesn't exempt you from the TV license. You have to, if you watch live TV, any live TV, you have to pay. Wow. So some people genuinely, so there are more and more people actually who are choosing not to, because obviously this TV license has been around for many, many years, since the BBC existed, which is I think 50, 60 years, maybe longer. And obviously Netflix and Amazon come along the last 5-6 years, and people might think, oh, well, just going to, give a few quid to them each month and I'll abstain from the BBC, which, it's a challenge for them, I suppose.
Well, and that device can't tell if you're watching it on your phone. Suckers. Maybe it can. I don't know how it works. You gave me a look like, no, they'll find me.
They're crafty, these vans, I tell you.
Yeah, but, see, I want to intern with one of these agencies. I want to come over, and I don't know how people would take to an American asking for their TV license. That would be.
I think the equivalent of this, for me, like looking across the pond, is what's your tax service called? The DRS, something RS, IRS.
For the IRS, yes, you're talking about federal tax. Yeah, federal taxes, Internal Revenue Service. Yeah.
That's it. So I think of the IRS, you make a single mistake on your tax return, that everyone does a tax return, right? Does anyone not do one?
You can file jointly if you're married.
Got you. Okay. So everyone feels that if you make a single mistake, they're round at your door and they are saying, what are you doing with your tax? Because I find it really, because obviously all our tax is paid automatically through our wages, or most people. Some people self-employed, have businesses and what have you. But
that's similar. That part's similar. Most employers will take care of that unless you're a contract employee or self-employed. you have more room to mess it up if you're self-employed like I am. I hope the IRS isn't listening. No, I'm just kidding. But I that's why I actually pay an accountant to help me out with that, because it is complicated. And the worst part of it is all the complications of the rules. Essentially, what happens is if you make a mistake and they find it, they spot check records, I think. And then there's a lot of things that are automated nowadays where it's like, hey, you didn't put this on your thing. It didn't come up. And generally speaking, it's actually funny because it has a reputation of being hugely draconian. And speaking as a self-employed person and knowing other self-employed persons, I had a buddy who they made a big error on his taxes. His accountant actually did. And he found out he owed a whole bunch of money. And the process of working it out was basically talking about, okay, how long do you think you want to pay it off? Well, let's just set up monthly payments. And it was even some flexibility over what he paid. And so, it's actually more, you do have to pay it, but it's as long as unless you're absolutely refusing to communicate back with them, then they can garnish your wages or whatever eventually. But typically speaking, you work with them, and they're not like the tough TV. They come in and take your TV people. That you're talking about. No, I'm just kidding. But it is, it is quite interesting to have to. So wait. Do you even file? Do you file taxes every year, or is it all just you don't have to fill anything out?
Not unless you're self-employed or you own a business.
Okay.
So if you work for an organisation, it's called pay as you earn tax. So it's automatically deducted from your wages. You see the little thing.
So we still have to fill it out, even if you're employed. You still fill out your own tax return and all that stuff. So interesting.
Yeah, and it's but I must admit the IRS I thought it was more draconian. I'm clearly learning all my knowledge about. I just remember there's an episode of The Simpsons where Homer fills it in late, and he sort of balls it all up and he throws it in and he thinks he's done it, and then they make him spy on someone. The FBI are involved.
Yes, no, I remember that where he's got like, he says something about saying he doesn't want to lie on a form or something. And Marge is like, "You lie dozens of times on our income tax every year." I think he puts down that Bart is 12 people or something like that. Yeah.
It's a good one.
Yeah. No, it can. I mean, it can be if you're defrauding or committing crime. I guess they do have. They're a federal agency. They do have arrest powers and things, obviously. But as far as I understand it, but that would be more for criminal doings, and essentially their biggest power is that they can absolutely hold money over your head and say you owe however much they say you owe. So, but no, it is hugely uncomfortable. People do worry about getting audited because you have to then provide a whole bunch of evidence of receipts and things for the year, whatever it was you claimed. I guess that's part of it too, is we have the opportunity to take a lot of exemptions. So it sounds like you're basically like, you've got it all lined up already. And that sounds a lot more convenient to me, but then you can't claim that your kid is 12 people. So
no, you certainly can't. And just, I suppose when I kind of find the idea of everyone, asking to see someone's tax return, I wouldn't even know what one looks like, because most of us would never have to fill one in. The whole rigmarole of I'm running for president, I'm going to show you my tax return. We don't have that, because what are they?
That's funny. Yeah, you have to use it for anything here, like to check your credit or to buy a house or, anything like that. That's one of the main things you show. So,
It's an educational show. We're breaking boundaries here.
I totally just pulled the wire out of my headphones, so I couldn't hear you.
Oh, I was just saying, we're an educational show. We're breaking boundaries here.
I know, it's great. It's just like... We're getting deep dive on TV licenses and tax returns. That's what people really tune in for. So to any of you who are still with us at this point, thank you. Really appreciate you hanging in this long. Thanks, Josh. I appreciate having you there. Plug your organization for everybody. Tell everybody about Improving Lives.
Thank you for the plug. So I work for Improving Lives. We're a local mental health charity in the Midlands, in Nottingham, in the UK. We are going through a bit of a challenging time at the moment, in the sense that we're publicly funded by the National Lottery. It's coming to an end shortly. We're hoping to reapply to them and be successful. But if anyone can support us to keep delivering mental health services to to people with complex needs as we do, we'd be very grateful. And find us, Improving Lives Knots. Google that and you'll see all about us.
Knots.
Thank you.
N-O-T-T, right?
N-O-T-T-S.
N-O-T-T-S,
Not
I should say.
Short for Nottinghamshire.
Yes, great. No, great organization. I actually really like your guys' website too, from what I've seen of it. I've looked it up, I think, whenever you're on the show, because I put it in the show notes, which everybody should be able to find that as well. So, and I still haven't figured out what you have a sports podcast. If you're still doing that, I never could find it because you wouldn't tell me the name of it.
We're on a hiatus.
Okay.
So we've just our lead presenter's just had a little boy. He's had a son. So
okay.
We're on a bit of a hiatus, and I'm loath to mix work and pleasure. But
I know that's the thing. So just so everybody out there knows, Googling Josh Wood soccer podcast, football podcast, those didn't work. So keep keep searching, everyone. We'll find you.
Thank you for listening to the Court and Parts Podcast Network. To listen to more Court and Parts shows, visit courtandarts.com.